Yes, good morning, ladies and gentlemen. Abin da muke so mu ce yanzu shine muna da 7 steps of performing hand hygiene. Number one, abin da za ku duba shine you just on the tap, on the tap. So on the tap, we have almost 4, hand operator control. When you come, we have different types of operators, that's controls of the tap. One, we have hand operator control, the one that you will open with your hand. Then second, we have knee level operator control, the one you will open with your knees. We also have elbow operator control, which the one you use your elbow to open the tap. We also have infrared operator control. This is infrared, shi kaman sensor ne. It's like when you come in front of the tap, the tap will start running. So that is infrared. So it's just sensing the person that comes in front of the tap, then the tap will on. So the next thing after you have on the tap is for you to wet your hands. Ka jika hannayenka da ruwan from below the arm, then you wet your hands. As you wet your hands, the next thing, then you apply the liquid soap from below the arm to the palm of the hands. That's where you will apply the soap. Also, after that, when you come to apply the soap, you are expected to apply about 4 to 5 mils of liquid soap. So then the next thing, after you have applied the soap, shine abin da za ka yi na gaba shine rub your hands through the following step. When you rub your hands, while rubbing the hands, you can follow from this A to E. 1, you rub the palms of the hands. After you have rubbed the palms of the hand, then you interlace your fingers in between your fingers. Then you interlace in between the fingers. Ka cuccuɗa tsakiyar yatsunka. Baya ga haka kuma, you can also work back of the hands, right and left. Then after that, wash your nails, wash the thumb in circular motion. Washing nails ɗinka, thumb ɗinka, babban yatsanka in circular motion, and wash the nails. Don't forget to wash the nails. That is for those that slightly has the long nails. They are expected to wash the nails too, not to go and infect the patient. And also rinse your hands. After you have finished rubbing the hands, then you rinse your hand under that running water. Then you also up the tap. As you come to up the tap, slightly, you have contaminated the control. If it is hand operator control, what you need to do is you must use a tissue paper to hold the handle to up the tap, or if you don't have that one, you can also use flannels to up the tap. If you don't have all those things, then next you have to pour water on top of the handles before you up the tap. Don't use your elbow, don't use anything to touch the handle after performing the hand hygiene, apart from those steps I give you. Also, one last thing, dry your hands by use of clean towel. Make sure you always use clean towel to dry your hands. In the absence of clean towel, then you can also use electric hand dryer. Sometimes you may see it's pasted on the wall where we normally use it to dry our hands. Mostly it's you will see that one in developed countries. And also we have, in case you don't have towel, you don't have dryer, then you also use air wing to dry your hands. These are the 7 steps in hand hygiene. One thing we have to remember, why do we have to wash our hands from below the arm down to the palm of the hand or to the fingers, is because we normally started from the lower concentrated area to the higher concentrated area in the infectious process. Now, looking at the palm of the hand is what touches the patient directly, or is where will touch the patient directly. So you are expected to start washing from below the arm, which is the lower concentrated area, from there to down to the palm of the hand and fingers, which is the higher concentrated area. That is also very, very important point that we have to use. And also, why do you have to pour water on the handle in case you are using hand operator control? One thing you need to understand, it is very, very important to understand that the first time you came and touched the handle is like, your hands is contaminated, and when you use that one, you have to understand that you have contaminated the handle if you did not pour water on top of it, or you did not use tissue paper or flannels to up the tap. As you touch, you have recontaminated your hands, so definitely your hands will be recontaminated. So that is why you have to pour the water on top of the handle to clean up what the contamination that is on the handle. I remain Nurse Pashkar, a clinical instructor, State Specialist Hospital Gombe, as well in College of Nursing Science and Midwifery Gombe State. Thank you so much. Remain blessed, BMP17 and any other nurse or healthcare provider. Thank you so much.